that we are here. 'Tis the season. Merry Christmas, Happy New Year to everyone. As we wrap up 2023, a board meeting, just want to tell all those that are in the room and watching at home, and those that are not watching at home, please pass on to anybody that's a part of our district that we are so appreciative of everything that everyone has done, and that we are grateful to the employees and the staff that take care of our students. And so can't go on and on and on, but just wanted to make sure that that was said tonight. We also like to thank all of the individuals that helped to get to this point. Board meetings are extremely busy, and so there's coordination that goes on, and there's different responsibilities that go into place to get us to this point. Specifically, thanks to John Moss for the AV and Stacy and her team for the logistics and the agenda. All right, we will begin with the Pledge of Allegiance, and we'll ask the esteemed director, Sean Kelly, to lead us in that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, we will, let's go with the information and the informative part of our agenda, and then we'll work into public comment. So it's nice to have Aubrey and her team here tonight to give us an update on the wellness programs that are going on in the district. It was good to see her last board meeting, and we're glad that she's back and going to give us some information about what she's been up to. Welcome, Aubrey.
Thank you.
We're glad you're not back as often as we saw you a couple years ago.
Aren't we? No one more than me, I can assure you.
Really nice you have a face, too.
I know, I do have a face. So before I begin, I would be remiss if I didn't take a minute and thank you guys for the very, very generous Christmas gift that was given to our employees. I happened to be with one of my paraprofessionals when she received word that she was getting some extra cash this year. And it makes me emotional when I think about her reaction. She literally burst into tears and just repeated over and over, I don't know if you understand, this is a life-changing amount. So thank you. It was no doing of my own, and I wanted to pass that appreciation on to each of you. So thank you.
Thank you. Make sure you introduce your team. We're glad that you're here with us.
Yes, so I am here, and I am the unfortunate one that gets to come and speak. However, what I'm going to be sharing with you is the result of incredible hardworking individuals. So we have a team of 4 nurses, and then each campus has a health aide. And I have a couple of amazing staff members here that wanted to come and see this as well. So Stephanie Adams is in our blue scrubs. All of our nurses wear blue scrubs. And then Allison Heisterman is in gray scrubs, and she is the health aide at TMS. And she has had some life-saving experiences this year, and it's been so awesome to watch her succeed. So I wanted to start by just helping you understand kind of the difference between what the Utah standard is for nursing care in schools versus what I will call or refer to as the Wasatch Way. So in Wasatch, we not only do what the Utah standard is, but we go above and beyond that. So one of the really neat things is in our district, everyone who is qualified, meaning you've had to work a certain number of hours in a school, has their national board certification. Out of the around 350 school nurses in the state, less than 10% of them have this board certification. It's difficult to get. You sit for a very long board exam, and then you have to maintain that. So we truly have cream of the crop staff. In addition, we have responded to several different emergencies, as we do every year, and oftentimes we beat 911. We've become so good at emergency response that we've actually avoided having to unnecessarily transport students, and then we follow students who are transported to the hospital so that they have a representative from the school district caring for them or watching over them until their parents arrive. We also provide telehealth and standing orders and point of care testing and drug testing. You heard about drug testing last week. We provide free vision clinic care, so we provide transportation to the eye doctor, free glasses with a free exam, and follow-up care for these patients as well. We are members of the intervention teams and crisis teams at each of the schools. We do all of the concussion and TBI case management, so we get our kids who have TBIs back to learning appropriately really quickly. We have certified CPR trainers who teach not only our staff, but also all of our 9th grade students and most of our 7th grade students CPR as well. We are the instructors for all human sexuality instruction. So we teach for 3 to 4 days each semester at the high school, and then we do the same for maturation, we teach in 5th grade as well. We sit on different community health and wellness teams throughout the county and throughout the state. And we offer parent education nights. We're hosts of the Type 1 Diabetic Club at the high school. We also are the hosts of CAPS. For the health and medical, we take projects for the CAPS kids. So what I'm trying to explain is we do so much more than what is required because we know it makes a difference. So it would be easy to think, gosh, we must be overstaffed then in comparison to other districts, but that's actually not the case. You can see that we're kind of in the middle of the pack. Out of 31 districts that answered, we are ranked number 19 in staffing. So for every one nurse, we are responsible for over 2,000 students. So it's kind of a heavy load. So the responsibility of the nurse is not only to monitor the care and intervention for students with known disabilities or diagnoses, but we also will be the ones that are responsible for whatever happens in a day-to-day environment. So back when I started in 2017, I started immediately looking at data, and one of the things that was disappointing to see was that of the students who come to the health office or to the office for care, somewhere between 25 and 50%, depending on which school, were being sent home. And we know that kids who aren't in school don't learn. So this was a number that right away we wanted to change. In 2019, we had this number down to 12%. In 2022, even though we were still dealing with a little bit of the repercussions of COVID, this number was still down to 5%. And then this year to date, we are at 3.8%. So that's pretty amazing. We are also up this year alone, 2,000 visits from last year. At this time, we've already seen 12,000 students this year. Of those 12,000 students, about 2,000 required a nurse to go in and provide a higher level of care. We are seeing a higher acuity than we ever have, and this is statewide. We're just seeing an increased acuity, more difficult diagnoses. Sorry, I'm not sure what happened to... We lost our presentation. Okay,
We're still seeing.
great. So 141 emergency events have occurred this year, and then we've had 58 students of those that needed further care outside of school. So our school-based clinic expansions that we did last year, we started what we would call like a school-based clinic, and that includes telehealth and standing orders. And this year we've given over 3,000 standing order medications keeping kids in school. In comparison to last year, this is a huge increase. Last year, all year long, we gave about 1,800 or 1,900 medications. So we're seeing a huge jump already this year. We also offer point-of-care testing and telehealth visits, and 100% of our visits that we've had on telehealth have resulted in a prescription. And that's probably not super exciting information for you, but what it tells me is that our staff are qualified to identify symptoms and know when we need to intervene. We're not wasting anyone's time, we're not wasting anyone's money. We also see that kids who participate in our program get back to class much quicker. So about 80% of our kids who use our telehealth services are back to school learning in less than a day. That's huge. That's half day or less that they miss in school. So for example, a student who has strep throat, on average, a student with strep throat will miss 2 days of school or more across the nation. Students who use our program miss half a day. So it's a huge savings. So just some examples of how this program has worked. So we'll call her Jane Doe 1. So Jane Doe 1 has chronic ear infections. This is an actual case study that we're using with permission from parents. And she'd been coming down to the health office regularly complaining of ear pain. So the nurse monitored her ear. It wasn't quite infected, there wasn't much to do, and this was a known issue. After about 10 days, it had turned from just fluid in the ear to an ear infection, and so mom wanted to connect to telehealth. And it was super easy. Mom was able to hop on the call from home, and the student was able to go back to class with pain medicine started, and mom picked up the antibiotic on the way home. So this student didn't miss any school, and the parent was so excited about this program and how easy it was. She said that there was no other way to get her care in the next 24 hours. So this student was going to have to go home in pain and wait to be seen until the next day. The second one is, although it's also an ear infection, the part that's unique about this is this happened to be one of our employees' children. So this is from a teacher at one of our middle schools, and her daughter developed ear pain while at school. We notified mom, who was teaching at Rocky Mountain, and mom's choices were leave and get a substitute or use telehealth, and she decided to use telehealth. We told mom, hey, when's a good time? And she explained that she had a class that would work well for her to step out for 5 minutes, and so we scheduled the visit for then. Mom stepped out. She was able to continue her day at work. We didn't have to get a sub, and we didn't have to miss any school for the daughter either. One of the things that I love, the mom's quote is a little bit long, but one of the sentences that I love that she said is, if I ever got a job somewhere else or moved to a different district, this is a program I wouldn't have. The mom was so excited that not only was this a benefit for her daughter, but as an employee that she can use this program for herself, and we have had about 10% of our telehealth visits used by employees for themselves. So if we look at the attendance impact in particular, last year in our pilot, over the entire course of the year, we saved 2,000 days of education using these programs. This year to date, we have saved over 3,000 days of education, and we're only about 4 months in. So if we take this same trajectory, we anticipate that by the end of this school year, we will save probably over 8,000 days. So that's a 275% increase in education days just from last year. We know that this program is growing. Parents are loving this program, and it's so much more than just keeping kids in school. This program is also about giving back to our community, who is amazing. So I just want to end with a little story about one of the programs that we offer through the health services is called Sight Buddies. So Sight Buddies is run by Charity Vision International. We partnered with them this year for the first time. And they donate time if we can find a local provider. And our local provider who volunteered was Dr. Sight's clinic, and he's with Wasatch Vision. And we took nominations from all the different schools and collected 40 students. We collaborated with transportation, who provided us with a bus. We collaborated with our food services, and they provided us a sack lunch for each of these students. And we picked them up, we took them to the eye doctor. They got an eye exam. They got a prescription and went back, and we brought them glasses about a week and a half later when they were finished. One of our students that participated in this program is Lincoln Flynn. And Lincoln's mom, Lincoln's mom was diagnosed with stage 4 cancer. And the dad has been unable to work since April, as he's been caring for his family and his mom, and Lincoln's mom. And Lincoln is a kindergartner this year, and it became clear very early in the school year that he couldn't read because he couldn't see. And so this program, he was nominated, and we were able to pick him up, take him, and get glasses. And this changes the trajectory of his education. We also provided glasses for several other students. In particular, I had a middle school student in 8th grade who, when I delivered his glasses, I asked him to turn around and look at the wall that was full of words. And I said, "Can you see the wall?" And he said, "I didn't know I could read. I thought I was just dumb." So this program and all the other programs that we offer changes lives. When we keep kids in school, they learn. When we help kids see, they can read. It's an incredible opportunity to work for a district that allows us to make a difference. And I am so grateful to the board and to my incredible staff for working hard. It's a lot of work to do the work that we do. And it requires my staff to work, I would say, harder than almost anyone else in the district. And I am so proud of them and so proud of working for you and the incredible generosity and kindness that you've given me to do what I love, which is helping kids. I'm happy to field any questions you have about health services. That was just a general update. If you have anything specific, I'd be happy to answer questions.
I have a quick comment or a question. Can you run the slide back to the districts?
Mm-hmm.
I'm just curious about what is the average ratio, nurse to student?
Yeah, so Utah is rapidly, sorry, it's not showing and I must have lost it.
It's okay, we can
Okay.
just tell them.
So Utah is rapidly increasing the number of nurses they have in schools. Right now, the average in each school is about 1 to 1,800 students-ish. And that's not, and we're one of the few districts that doesn't have a special education of our size or larger that doesn't have like a special education nurse. So it's actually a lower ratio if you take out some of the other things, and it averages out to about 1 to 1,500 students. And we're at about 1 to every 2,200. Any other questions?
I just have a comment, as a mom of 4 kids, when they were all home, this would have been so nice.
Yeah.
Like how many times as moms, maybe dads too, but we're home and we get that call and it's like, oh, or you've got your baby with you and
Yeah.
your kid's not feeling good and you're just, oh my gosh, I've got to go to the doctor and got to call and get an appointment. Like it's just so much, right? This would have been so nice. So I support this 100%.
Thank you. I mean, for me as a working mom, it is so nice. I can stay at work and my kids can get the care they need.
I was just going to comment, Kim and I were lucky enough, I don't know if anybody else had time to do this, where we got to volunteer to help with vision screening. What you guys are doing is awesome, and it is true. If you can't see, you can't read. And some of these kids, it's like mind-blowing to them
Yeah.
when they can finally see. So, I mean, just basic stuff like that, it changes the trajectory of a lot of little lives.
Yeah.
And it's awesome. So thank you for everything you guys do. And I know TMS has been hopping because my kid goes there. So Allison, thank you for everything. And I know nurses back up our health aides. You guys are awesome. Thank you for your hard work.
Thank you.
All
All right. Thank you very
Thanks,
much.
Thanks, Aubrey.
Okay, moving along, we will start with the comments. If anyone has a comment for the board, come on up. We have a couple of minutes, and we'll just move through them one at a time.
Okay, we'll go first.
This is a good group.
No, you gonna talk. Okay, I'm gonna talk. For the record, Jenna Horrocks, 474 East Acord Way. Anyway, we're just here to say thank you. Thank you for supporting teachers, paraeducators, nurses. That's amazing. I loved listening to that report. For supporting every single person that works in this district. I too had an experience like Aubrey. I had a paraeducator who burst into tears because she could finally pay off some medical bills. So it did not go unnoticed. So thank you so much. And Merry Christmas to you all. And we have a small gift for all of you at the break. So thanks for all you do.
Thank you.
Thank you.
Jenna, thanks, Michelle.
Okay, anybody else have a comment? Great, we'll close the public comment session and we'll move to the consent items. I move that we pass the consent items as listed.
Second.
All in favor?
Aye.
Consent items pass. All right, we have one action item tonight. We'll invite Dr. Campbell, the esteemed Dr. Campbell, to come up and walk us through action item number 1.
Thank you. As part of the policy review hat that I have, one of the policies we came across was a rather old one and it happened to deal with my job description. Not sure why my job was, description was in policy. That would be the only one that would be. So this evening, we recommend that we retire, it was done in 2002, the student services policy, which is actually just a job description for student services. This is our recommendation. It is our policy number 430.
So moved.
Second.
All in favor?
Aye.
Aye.
Okay, action item number 1 passes.
Thank you very much.
Thank you, Dr. Campbell. All right, for a board report, I know that after this meeting, we're gonna get together and have some holiday cheer with the individuals on the board and their spouses. We're also going to meet Tuesday the 3rd, is it Tuesday the 3rd?
Wednesday.
Wednesday the 3rd, with the high school naming committee. And we're moving along with that process, and the progress is moving along nicely. And then
What time is that?
3 o'clock. 3
At the
o'clock
high school again.
at the high school. And then lastly, not to steal the superintendent's thunder, but we'll be going to the state school board convention that first weekend in January. And those dates and times are to be discussed if you have any questions with Stacy. Anything else from the board before we turn it over to Paul or Jason? Okay. Paul, anything from the superintendent?
No, I don't, I don't have anything further. I would just say that, we've had a good December and, Merry Christmas to everyone, and we look forward to a little dinner tonight, and then like always, we'll, as President Hanson mentioned, we'll hit it hard coming off the break at our state convention.
Yep.
Thank you.
All right. Anything else from anyone? All right, Tyler, I think this might be a record.
Well, yeah. Good
Yeah.
job.
All right, I move that we adjourn.
Second.
All in favor?
Aye.
Thank you, everybody. Merry Christmas.